Welcome today to the first podcast of the Farnova Medical Group Mental Health Series. Today we're going to be talking about anxiety, and we have with us Dr. Roya, who is a physician practicing in Canada. Welcome, Dr. Roya. Can you tell us a little bit about yourself and how long you've been practicing for?
Sure. Thanks, Linda. Hello, everybody. My name is Roya, and I have been a physician in Canada for the past 25 years. I've been practicing family medicine. In my past life, I actually graduated in ophthalmology or postgraduated from ophthalmology in India. And then I went and worked in England as an ophthalmologist. After I moved to Canada, I changed my practice. I did a few of other things. And then I have come into family medicine with a special interest in psychiatry. And I've been doing a lot of psychiatry as a part of my practice, working with CMHN, which is the Canadian Mental Health Association here in Canada. And that's all about me.
So today we are going to talk about anxiety, and it seems to be much more prevalent in society now, or people are talking about it more. What is anxiety?
Very true. Anxiety has become really not a pandemic. It's become really a big deal now. And I hardly see any person in my practice that is not having some form of anxiety. Anxiety is excessive worries to an extent that it bothers people in their normal daily functioning. Their function, whether it is their sleep or whether it's their work, whether it's enjoyment of their life, whatever thing that they are doing in their life, it is actually bothering them. Sometimes it's mild, so it's not affecting it bad enough that they would, need to see anybody. Sometimes it's moderate and sometimes it's really severe. And in that one, it actually can get into other diseases, other mental health diseases.
How do you know if it's mild or severe? How would you yourself know if you are having anxiety?
That's a very good question, actually, because when it's mild, you know that it's not affecting your life in some way. But if it is affecting your life, say, for example, you're continuously worried about any particular thing, or if there are specific phobias, or, there are other things like social anxieties and stuff like that, that affects you in a way that you can't actually go out and meet with people or be with others, and you get really panicky or you've got panic disorders, any of those things, then it would be definitely a time to go see a doctor. Also, if it's becoming prolonged, because anxiety really, as per definition, when we call it a disease, is when it's affecting you for more than 6 months or more. So if you think that this is becoming a continuous thing and it's not situational, it's not based on something which has just happened, you have to go to court, you have to go to somewhere, and it's causing anxiety and it's short term, then it's still okay. But if it's becoming a permanent thing almost, and it's a long-term thing, then you definitely need to seek help.
Are there different types of anxiety?
Absolutely. One of the common ones are generalized anxiety disorder, which is basically being anxious or excessively worried about different things in life. Then there are other kinds like specific phobias, for example, agoraphobia, not being contained in the small spaces, that becomes a problem for the people, or social anxiety disorder, when you're in a meeting with other people or you've got to be in a place with other people, then you get anxiety. It could also be panic disorder, like you have really more of a physical symptoms of anxiety than anything else. That could be one of those kinds. And then there are other kinds, and there are other associations like OCDs and post-traumatic stress disorders and situational ones. Those are all different types of anxieties.
What are the symptoms? There's so many different types of anxiety. What symptoms or signs could you have to know that you have anxiety?
Anxiety is usually when you see that you're worried about things constantly to the extent that either you have physical symptoms or you can't really concentrate much on things because you're continuously worried about things, or you're unable to sleep like you have insomnia or you have broken sleep or feeling your heart palpitation, heart beating fast, being irritable continuously or at little things. There are many ways of really finding that you have got anxiety, but basic thing is that something is not right, that you feel uneasy. That's the easiest thing I can say, that you feel uneasy and something is not right. That's when I think if it is, lasting for more than 2 weeks or longer than that, it's better to, talk to your doctor and make sure that this is not becoming a long-term thing. Specifically, if you have, like, of course, it's different between adults and children. The symptoms are really different. In children, many times it is physical symptoms, like kids will have abdominal pain, they have diarrhea, like they have an exam, they don't want to go for exam or they're afraid.
They
And
don't want to go to school in the morning.
absolutely, absolutely. There's various type of things that would actually show you, or they'll have headaches, or they'll sweat. Sometimes they actually panic. They feel like their heart is beating too fast. All of those things, like in children, as I mentioned, it is more of physical symptoms, even nausea, vomiting, any of number of things can be there. And in adults, however, they can control it for a longer time before it becomes physical, unless they have panic disorder. In panic disorder, they definitely would have some kind of numbness, tingling in their hands, feet, around their mouth, or feeling like they're going to die. We call it impending doom. Or they feel like there's a lump in their throat, or they feel like they can't breathe. They wake up in the middle of the night, like about 2, 3 a.m., and they wake up and then they have to go get some fresh air because they think that they're going to be not able to breathe. So a lot of different things can be a symptom of these anxiety disorders.
And do you find a lot of patients, when they're coming in with these symptoms, they're thinking that there's something physically wrong with them and don't think or realize that it's anxiety?
A lot of them actually, interestingly, don't even know that this is a symptom of anxiety. They come saying that, oh, my hands and feet are, numb. And it's further into questioning that or they come with headaches or tension headaches. They come with palpitation, or they feel like they're dizzy and they're going to pass out. A whole variety of things that they do feel something is not right. And I remember when I was in Emerge, actually, I used to have quite a number of patients who would come, and we have told them like so many times, but they keep coming back thinking they're going to die of shortness of breath. So
Right.
even after you tell them, they don't really think that this is anxiety. They think it is like something real, and they think that you're going to have a heart attack. So sometimes in the midst of all those things, it's really hard for them. But
How do you deal with patients like that? How do you um, not convince them, but get them to see that their symptoms are being brought on by anxiety?
Well, usually, it is only after testing everything else and showing them that they are okay otherwise, that they will accept. Because, and even though some of them with severe anxiety, even after everything has been tested, because of the anxiety and excessive worry itself, it's hard for them to understand that it is. And they keep telling you that, after 6 months of it, maybe something new has happened. So maybe my chest pain now is because of that. It becomes really a big deal sometimes, but most of them, if they get treated, then hopefully they don't get to a stage where you have to go through all of these things again and again. By that time, they come to know. But for us, even as physicians, we want to make sure that there is nothing organic causing these things, because all of these symptoms can be also similar to something like thyroid disorder. A hyperthyroid patient can present with the same kind of palpitations and not being able to focus and being irritable. All of those things can happen, and a lot of other symptoms like a diarrhea and all those kind of things, which could be with the anxiety as well. So even for us, we want to rule out some of those main things the first time around, unless it's really, really very clear.
Can anxiety be a genetic disorder or is it a learned behavior? Like if the parents have it and the children see the parents being anxious, then the parents are more, or the children are more prone to being anxious?
Absolutely both. So it can be a learned behavior and as well as it can be a genetic behavior. So the genes pass through from the parents to the children, and definitely that can be passed on to the children. So does a lot of other mental health disorders. So it can also be that the parents would have had some other mental health disorders and the children would end up with anxiety. But the behavior itself also, if you haven't sought help and you are exhibiting all the symptoms of the anxiety, or you behave in an anxious manner and you're worried all the time, even if the gene is not passed through, you'll still, the children will learn. They pick up on that and they learn. It's an energy, basically. An energy of anxiety is a negative energy and it passes on. And they learn to behave. And we always say the children are the mirror of the parents. So if a mother or a father has always been worried, they learn
Right.
to be worried. And so it kind of is both for sure.
What are the risk factors for anxiety? Is something in particular put people at risk?
Yeah, absolutely. The risk factor, one of them is just what we just mentioned, which is genetic factor. And if the parents have got that disease, obviously it is easy to pass it on. Then there are different segments of people, like the population who are, let's say, in my practice, I see a lot of immigrants who come from countries where there has been a lot of unrest in their countries, and they have seen a lot of things that's been, a lack of freedom and worried all the time about their government and everything else that they're doing. Imagine people from Afghanistan or from Iran and some other countries where wars are going on. They would definitely have a lot more anxiety, along with other diseases like PTSD and depression and all those kind of things. Then, of course, there are also people who have got other mental health disorders. They can also be more prone to having anxiety because, say, for example, depression or bipolar or, PTSD or ADHD, all of those things can be associated with that or exhibit part of those kind of symptoms as well. So they can be the same thing. So whenever you have excessive worry, that becomes an issue that you have to think if it's really causing you problem, then you need to figure out, and it doesn't matter what kind of population you're from, still it's there. Then there are, students when they have exams and all. So that's another time when they have worries. Then when there are losses in the family. So whether it is because of a divorce or whether it's because of a separation or you've got to go to court or you've lost a person, meaning to death, those are all the times that you can become anxious as well. Moving is another thing, they are very common. They would be in most of the mental health disorders, they get worse because of that. So any traumatic situation, soldiers of the wars and all, when they come back, same thing. All of these people, they can have some form of anxiety or the other.
And so mental health disorders such as depression or ADD, things such as that, can cause anxiety, but can anxiety cause any of these issues? Can anxiety manifest into a depression, for example?
Absolutely. Absolutely. Very good. And I'm thinking that this is probably because of your experience that you do know about that. Absolutely. Anxiety, if it's untreated, it definitely can lead to depression, or I wouldn't say things like bipolar or schizophrenia and all, because for those, you have to have a basic, another kind of
Right.
disorder to have those. But anxiety in the severe form, it can lead to depression because if you are all the time worried and you can't get out of the house, at the end of the day, you're going to become depressed. If you can't go to take your exam and you're failing, then it eventually ends up in depression. Not only that, but also it can cause other physical disorders like anxiety excessively. If it's not treated, it can cause heart attacks. It can cause not only diarrheas and headaches and all, but it can cause strokes. People, we used to have a lot of these strokes when I worked in Emerge. I used to have a lot of strokes and heart attacks, which would happen on Mondays when people would go to work. So if there's a stress at work, then that would be absolutely, a waiting disaster to happen. So all of these things, if they're not treated, people don't realize that it leads on to the other diseases, and they don't realize that it causes a lot of things like ulcers. Ulcers are one of the commonest thing I see in children, in fact. In children, when they get anxious a lot, if I ever see an ulcer or I see a reflux disorder, having high acidity and all in their stomach, they always think anxiety, because in children, you shouldn't really have those things. Very,
Right.
very rare. So, yeah.
What are some ways that we can treat the anxiety? And is it different for adults and children? Like, what are the best approaches for treating anxiety?
First of all, I would say whether children or adults, I think one should really seek help. That's one of the first things I would suggest. Because I don't know if this anxiety is just anxiety or it could be a symptom of another disorder, which means, just as I said before, it could be a thyroid disorder or something else. So I would always say definitely seek help. Don't try to treat it yourself. That's the number one thing that I would have for people, advice that I would have. The other thing is that the treatment could be two types, whether it's children or whether it's adult, it doesn't matter. The treatment is always almost the same way. One is the medication, and the other one is the behavioral treatment. So those are the two biggies. In the behavioral treatment, there are ways that I personally use in my practice, and some other physicians they do use that. Some psychiatrists and all they use it, but I use a very specific one, and I find it to be responding very, very well to that. Meditation is one of them. Then there is gratitude. There are dancing and laughter. There is getting out into the nature, walking or running or hiking, any of those things. That's great. And there is also box breathing. So that's different from meditation, because there are some people who don't like to do meditation. I've had patients who are, like, for example, Catholic or Protestant, and they don't like to do other things, which is okay. And for those people, they can do box breathing. And box breathing is a very simple thing that actually benefits quite a bit of people, and it kind of calms them down. If they are done routinely, they are actually helping people to calm down and to be able to clear their head and reduce some of the worries. Dancing and laughter is a very, very important thing, along with gratitude. It changes the way we think, because in any kind of mental health disorder, it's a disorder of thought. It's the organization of thought that's a problem. That's the main problem. People are not managing. I call it mismanagement of thoughts. When you are not able to manage it, then your thoughts will run in all directions.
I've heard you in the past refer to people like a computer with all the tabs open, or their phone with all their tabs open, and that's what it's like in anxiety. Everything is open.
Yes, it's exactly the example I give to my patients. I tell them that anxiety and worry, excessive worry, is like you have a computer with a screen on, and then it's really as if it's hacked, and suddenly you have 10 screens in your screen, and you continuously trying to exit and remove them, but then another one opens and another one opens. So it doesn't matter how many worries you get rid of, there is still another one. And so you can never get to your actual screen and do the thing that you want to do, and you waste so much of thoughts, so much away time as well. And there was a time I did actually yoga. There was a time I was, and I've been doing yoga for a long time now. So in yoga, there was an interesting thing I learned, that people are actually having about 72 thoughts per minute, and in a normal person. So imagine that becomes a lot more than that. Out of those 72 thoughts per minute, you actually have 70 thoughts which are harmful. You have one which is useful, and you have one which is useless. So the useless and useful is a good thing, but the harmful one are the one that prevents you from actually getting to the useful one. So the way we do the homework usually for our patients is to manage those thoughts so that you have more of one thought per minute rather than 72 thoughts. And like I said, in anxiety, you have even more than that. So that's what we're trying to do, to condense the thoughts, reduce the number of them, and reading really helps with that. And if you do that, then you can get better.
Does everybody with anxiety, does everybody need medication or can it be done behavioral? And if you need medication, is it something that you have to stay on for a long term or is it short term? How does that work?
That's a very good question because it's the worries of usually my patients that I have noticed, they don't want to be on medication for long term and they
Yeah.
think that they're going to be addicted to it according to them. And I have to explain to them that addiction is a different thing. Addiction is for the drugs that would make you dysfunctional, not the drugs that make you functional. So if you become a functional person, then that's not an addiction. It's something that you need, just like, diabetes or blood pressure. If you have it, then you may have to take it for the rest of your life, but that's because it makes you functional, then it's okay. It's not an addiction. Same thing with this one. So the answer to your first question is that no, not everybody needs medication. Usually I can treat people who are mild to moderate with just the homework if they are keen on doing the homework though, because some people think that they cannot do it for whatever reason, or they are really too worried that this may not work or something is happening in their life or whatever their belief system is. So for those who don't want to do the homework, then medication is the only other option, really. But for those who do want to do the behavioral treatment and the homework, and for that they have to do it on a daily basis, at least for 6 weeks, then they may not need that. However, for severe anxiety, I always do a combination of, and even moderate to severe sometimes, depending on the patient. That's a decision that the physicians usually make based on talking to the people and seeing how much of their function is being affected by it and what do they have to do in the next 6 weeks at least. And if it's something that, if somebody's going through a court and all, then that's not the time for me to sit down and ask them to just do the homework. So I would definitely give them medication and something to calm them down so that they can go through something, whatever situation it may be. Yeah.
Now, being in healthcare myself, I hear patients say, well, I've tried that medication before. It doesn't work for me, so I don't want medication. But not every medication works the same for everybody, correct?
That's absolutely true. Yeah. And, just like anything else, like antibiotics, amoxil may not work for me and even kill me, but that doesn't mean it won't work for my son or for somebody else. So the same thing with anti-anxiety medication. There are various kinds, and I don't want to go into the details of that, but I think it is something that even if something hasn't worked at that time, maybe a combination would work and or another medication works, or maybe the dosage wasn't right, so it may not be the right dose for the person, too much or too little, anything, any number of those things. Plus again, a belief of a person is a really important thing. If you believe from the beginning that you don't want medication, generally the medications are not going to work for you because you have already made that thought. So every time you take it, you feel like you're bothering yourself. So, or it's going to harm you. So anything that you think that way, you're not going to go and do it anyway. So I always work, I think, with patience because it's the patient who has got to decide at the end of the day, and we give the option and then they make the choice which one they want to actually go ahead with.
So if you have one piece or two pieces of advice that you could give anyone who thinks they may be having anxiety, what would you say to them?
Well, first thing I would say, definitely seek help. It's better to know than not know because, again, as I mentioned, we don't know whether it is because of some medical problem or because of psychological problem. So that's the first thing which has got to be rule, clear for you. And then the second thing is not to be afraid. I know worries would prevent a lot of people to go to
Yeah.
the physicians, but then remember that at the end of the tunnel, there's light. So you could actually discover that you would live a much happier and more joyful life because most of my patients, they don't really have a good life or a happy life. So you could actually surprise yourself by becoming more healthy and happy. So why not try it?
Perfect. Sounds like great advice. And it sounds like we all need to be dancing and laughing and doing our daily gratitude. Dr. Roya, thank you so much for joining us today. And thank you for everyone for watching and have a happy day.
Thank you so much, Linda, and thank you for your great questions. Thanks. Wish everybody a happy day too.
Thank you.